Hi, I'm Mike Rushton. I'm going to give you a very quick and simple idea of how to use all of the tools in order to fit and adjust the frames for your patients. Let's have a look at the tools. Flat round nylon pliers, wide jawed angling pliers, nose pad adjustment pliers, nose pad removal pliers, disposable hand towel or tissue, a microfiber cloth, a frame heater. First, we'll look at length to bend. We can clearly see here that the side comes along the side of the temple and the bend begins far in front of where the top of the ear is. Here we're going to need to make an adjustment to make the bend from here slightly longer so that it sits flush with the top of the patient's ear. After ascertaining how much length you need to add or take away from the side, you would then use your frame heater. Turn it on and apply heat to the temple tip. We do this as to not crack the acetate on the temple tip itself. When we have reached a warm temperature, we simply remove the side and we revert it to a completely straight angle. Whilst it's still warm, we can then create a bend at the correct place. This is done either by using the two index fingers or the thumb, so as to not create too much of a sharp angle behind the ear. Let's see how it fits on the patient now. We now see that the side comes along the temple and that the bend is situated at the top of the ear. This will hold the spectacles firmly and ensure that they won't slide down the nose. During the dispense, and possibly with returning customers, you may need to remove and replace nose pads. To remove the nose pads, we take the nose pad removal pliers. The two-pronged fork side slips in between the arm that holds the pad and the back of the nose pad itself, like so. We then squeeze and the nose pad is extracted. In order to replace the nose pad, we will need to use this tool, the nose pad pliers. You simply align the nose pad with the arm. You then put the cup part of the plier onto the receiving end of the arm, and with a bit of skill line it up so that the flat end is flush with the front of the nose pad. With a light squeeze, it's pushed back in. This tool can also be used to either splay the nose pad left or right. It can also be used to pull it slightly down with a small wiggle, and it can be used to go in and out in order to either raise or lower the center of the lens in comparison to the patient's eye. When adjusting the angle of side, What we are adjusting is the pantoscopic tilt. That is the angle at which the front of the frame sits against the customer's profile. We take the wide-jawed angling pliers and grasp the frame at the lug. We have all of the pressure isolated in this one area. We can then support the front of the frame and angle the side accordingly, increasing or decreasing the pantoscopic tilt. The angle of letback concerns how tight or wide the sides of the frame are along the customer's head. In order to adjust this, we use the flat round nylon pliers. The round section is put on the inside of the frame, and the flat nylon section is applied to the reverse. The reason for this is to not scratch any of the paintwork on the frame. Once a firm grip is obtained, you can simply pull the frame out or in and adjust the angle of letback to suit the size and width of your patient's head. To adjust the wrap angle of a frame, the best tools are these, your thumbs. The wrap angle is the angle that the front of the frame has in regards to the patient's face. There should always be a slight bend to the front of the frame. If the frame is sitting very flat, you would simply extend the sides, apply both thumbs to the bridge, and gently push so as to create a slightly tighter angle. After any repair or adjustment, it's likely that there will be fingerprints left on the frame, and more importantly, on the lens. The most effective way to clean a pair of spectacles is to take a piece of disposable tissue and some cleaning spray, apply some spray to the tissue, take the spectacles by the bridge, and with the moist cloth delicately massage the lens. This will remove any facial oils or any other build-up that may be on the spectacles. It's also worth noting that you should pay attention to the sides of the frame, as these need to be cleaned as well. After this first stage, you can dispose of the tissue and then introduce your microfiber cloth. This should only be used on dry lenses to give a shiny and brand new finish to the frame, remembering again to give extra attention to the sides as well as the lens. So that brings us to the end, and as you can see, just a small, simple adjustment saves a lot of time in the future. It will decrease waiting times for other customers, and it will make your customer feel happy and secure in the knowledge that the person dispensing their spectacles knows what they're talking about. If you have any more questions, you can direct these to a dispensing optician or a more experienced member of the shop floor team. Thanks for watching. Have a great day.